And from a, I guess, a personal perspective, I very much see the work of Flow and this quality improvement strategy as being a very significant platform, if you will, in how we move change forward in the healthcare system. So I think, as much as I said earlier, we're at a transition point with the Institute moving out of this work directly and being there in the background to support us. We really need to think about how do we fully take ownership of this work? How do we as a system be accountable to continue to support this work moving forward? From our part in the LHIN, we are looking at how do we use our tools to reinforce this work and to support and enable. And the tools that we have at our disposal continue to be some small discretionary funds. We've certainly tried to use aging at home funds and our priority funds in a way that supports a number of these issues, and there were reference to some of those specific projects today and the investments that we've made, for example, in the improvement advisor position. We will continue to look at how we use our funds in creative ways to support those kinds of initiatives and projects to continue to flourish in our LHIN. We're very committed to ensuring that we are seeing the outcomes. So I think I was going to try the quote and I'll mess it up now. Every change, I said it over there, didn't I? Okay, I got to get this. That not every change results in improvement, but every improvement requires change. Did I get it? Okay. So I think we need to make sure that everything we are doing is resulting in the outcomes and needing to measure that. So we really want to make sure that all of the initiatives we are supporting are seeing those outcomes. We need to have the courage when that's not happening to change course and do that as a system. We very much are ascribing to a lot of the Institute for Healthcare Improvement methodologies that were talked about today, trying to align a set of initiatives and a portfolio of projects that are all directed towards achievement of our system level aims and measuring those. We've got lots of learning to do and as to how we best measure, how we report on that, how we share that information and get it out into the system. But many of the themes and the lessons learned that we heard about today are the kinds of things that I think are informing and inspiring how we're trying to do our work from the LHIN perspective. And we're always very heartened to see the strong commitment and passion across the healthcare system for these efforts. And so I want to just applaud everybody in the room. For your great efforts. And I was thinking we kind of missed a beat. We could have had the whole day organized around an Olympic theme and that whole Own the Podium. And for those of you that, and I'm not an avid Olympic watcher, so I shouldn't try to pretend here, but some of the reflecting that's going on now on the whole Own the Podium campaign and whether that was the right thing to do or the wrong thing to do, and I really have no comment on that. But other than to say one of the comments that I did hear is that this is a long-term process. It wasn't meant to necessarily mean in this Olympic year we will own the podium, but it's something to strive for. And I think that the improvements we want to see in the healthcare system are something to strive for. And I think in the Southwest we can own the podium. We see lots of great examples where that's happening and the successes you're achieving. But we do have to figure out how to pull together as a system. And so, again, as we talk about this transition opportunity, how will we all work together? And from a LHIN position, we often have the opportunity to hear the conversations about, well, the CCAC didn't do this, or the hospital didn't do this, and it's the docs, they're not doing this, and well, why aren't the community support services helping with that piece? And sometimes we sit back and we hear these different perspectives, and it really is, I believe, about bringing the conversations to the table together. And you can see the benefit when your teams are coming together to work through the issues. The expertise and the knowledge is in the field. So we need to figure out those strategies that enable those conversations to happen. There is, I believe, no big bang solution to the challenges that we face in healthcare. There is an opportunity to get focused on the outcomes we want for patients and make this all about patients, clients, individuals, and really the whole experience of our population as it relates to their health and healthcare experience. So themes around triple aim and outcomes, patient experience, a sustainable healthcare system are the language you'll hear the LHIN talk about over and over again. And I think our opportunity is to continue to figure out the strategies that keep us all focused in the same direction forward. So I guess I want to close today's session by, again, acknowledging your work and your efforts to help move us forward, acknowledging that we believe we do have a role to play from a LHIN perspective in supporting and enabling and helping to facilitate, but that we can't do it without the partners that you represent at the table. And so continue to ask you to be part of these solutions, be part of these processes. At this point with the flow work, it does need to be sustained. It does need to continue to spread through the system. So as we work through the transition with CHQI, Kim, our LHIN coordinator, having left, we will need to understand the point person at the LHIN that you can talk to about the flow work. We want to make sure that this does move forward. So that will continue to be our commitment. We also need to look at how flow, Partnerships for Health, QUIP, how all of these pieces come together so that we can reach that tipping point where we develop that critical mass of expertise and quality improvement so that we can keep improving the system by working together. And that does mean we need capacity. We are a very stressed system in healthcare. Many of you are working at a full potential and beyond on a regular basis. So how do we create those levers for change and create that capacity is the questions that we ask ourselves about. We think we've made some small steps to doing that, but there's bigger steps that we need to take. So I look forward to your thinking on that over time. If we had another half day, it would be great to have had more of an opportunity for engagement around some of those questions and dialogue. But I think what we need to do is commit to taking those conversations outside of this room and have some of those conversations with the folks that we've heard from today, some of our leaders in the organization that have been involved in this process. You know, I think, Lori, your comments about physicians and how do we really crack that nut, so to speak, and get playing the same game. We've got to work through those challenges. And there's not easy answers, but I think a strong commitment to keep finding those answers by working together. And see a number of you nodding, and I appreciate that you've got a lot of passion and energy and enthusiasm to commit to this work. So continue to invite you to be involved. Certainly coming out of today, if you have some specific thoughts, issues, concerns, by all means, please let me know, let us know within the LHIN, talk to your leaders, and one of the things that we'll definitely be doing as it relates to flow, as a LHIN, we do meet regularly with the hospital CEOs and the CCAC, Southwest CCAC CEO, and we talk about a number of initiatives, and flow has regularly been on our agenda. I think what we need to do is heighten the attention on the flow work at that table in terms of the accountability for those participating organizations and ensuring this work continues to be supported and that we continue to see those outcomes. And we have a mechanism through that table to have the opportunity to ensure at a system level we're reflecting on the progress that the flow work is seeing across our LHIN. So we want to make sure that those conversations keep happening and that we continue to monitor where we're at with this work. Again, congratulations to all of you. Thanks to all of you. We will send out, Rebecca, I don't think we have an evaluation tool today, but we will send out an email to all of you so that you can send in any reflections on today. And again, any questions or comments or additional thoughts that you might have around how we continue to sustain this work. We will continue to link with the quality improvement advisors and the organizations that are sponsoring this work to ensure that we continue to support your efforts into the future. So thanks again for coming out today and sharing your stories, and safe journey home.